OASI, which is obstetric anal sphincter injuries, which is a collective term for third and fourth degree tears. A third and fourth degree tear is a type of perineal tear which includes the perineal muscles and the anal sphincter. Midwives have moved away from giving perineal support to actually delivering the baby without any support. And we think this is one of the reasons why there has been an increase in third and fourth degree tear rates or OASI rates. We came across studies, published studies from Norway that showed that applying perineal protection actually led to a reduction in OASI rates. We therefore invited Katrina Leni, who is the lead author of the publication from there, to come and actually show us how to do the perineal protection.
So the way that the project works is there are 16 pilot sites spread throughout the country, and they're arranged into groups of 4, and each group of 4 trusts will send a midwifery and an obstetric champion into the Royal College of Obstetricians and Gynaecologists for a skills development day. It's a quality improvement project that has 4 aspects to it. The communication is given out by the community midwife generally to the ladies when they're about 34 weeks pregnant. The second aspect is about manual perineal protection, and this is a technique that healthcare professionals, obstetricians and midwives can use to support the perineum at the time of birth, at the point of crowning, to try and minimise the risk of tears. So the third aspect is around the subject of episiotomy, and the care bundle asks that if an episiotomy was to be performed, it's very important that it's performed at 60 degrees from the midline at the time of crowning. So the fourth aspect is really about diagnosis, and this should hopefully not be very different to what healthcare professionals are doing already. So we ask that every single woman who's given birth vaginally in the pilot sites has a thorough vaginal and rectal examination to exclude any tears and to classify any tears that are there.
Last week we had a perineal awareness week. So every day we had our perineal awareness midwives, of which we've got a couple, and including the practice development midwives and our registrars. We were there in the morning with our mannequin, as you've seen, so that the midwives were actually practicing and having a go, watching the videos, so actually, you know, seeing firsthand.
I think it's incredibly important from a kind of non-clinical perspective. Seeing the effect that OASI have on women and hearing women's stories is kind of heartbreaking. So any project that could help reduce those rates is definitely worth it. And this one has the evidence behind it and a huge amount of support behind it as well.